Hello, I am Dr. Hanume Gowda, a consultant orthopedic surgeon practicing at AHA Orthocare, Nagarbavi, Bangalore. Pars defect in the lumbosacral area is a pretty common condition. More than 6 to 8% of the general population will have it. By and large, people don't experience much of a problem. They can actually lead a normal life and complete their lifetime without much of problem. There are a small percentage of people who experience problems. These are people who are generally very active physically. Active physically in the sense those who are into sports or some sort of physical activity like bending forwards and lifting weights, and these are the people who experience some sort of difficulty. So when they get a pain like this, generally with some sort of physical therapy. What is physical therapy? Physiotherapy, where we teach them exercises, correction of posture, proper walking and all walking technique and all these things will definitely help them. Whenever the situation goes a little bit beyond just the pain, that is when there is radiation of the pain into the hip joints or towards the knee joint or all over the lower limb, then that means there is a little bit of slipping of the bone. The Pars defect is called spondylolysis. Then this can lead to, when it is on both the sides, that is on the right and the left side, there are two parts in each segment. If both are broken or both are completely gone, then the bone or the bone can be slipping over the bone below. It will start slipping. The bone above will start slipping over the bone below. So as it slips, then the amount of space available for the nerves here will reduce, so that gets compressed. So we call it canal stenosis. We also call it secondary canal stenosis because of a reduced space for the nerves. So this can lead to a little bit of a neurological problem and may need surgical assistance. But still, whenever a patient experiences such a situation, we can put them on a regular physical therapy, give them a lot of exercises, correction of posture. The most crucial exercise here will be the abdominal exercises to strengthen the abdomen. Weight reduction definitely has got a role, and on a long-term basis, we may have to keep them on a regular observation and exercises. If the pain becomes severe, on a short-term basis, we can give a brace. Brace is a support to the back. The commonest brace used is a Boston brace, but it has to be used only on a short-term basis of about a week or 10 days till the rehabilitation takes over. Once the rehabilitation takes over, the muscle strength increases, you have to discard the belt, or else it might become an addiction. Addiction in the sense you might get dependent on the brace and your life will not be possible without the brace. So brace is not the treatment, brace is only a supportive thing. Exercises and posture correction, weight reduction, building up of your back muscles and abdominal muscles are the way to treat this. Rarely when there is a radiation and if it gets complicated, patient may need a surgery also.